After the study of the membrane transport, we have go to the inverted process. The first process is absorption. 吸收 absorption 吸收 Okay, first one to see the definition. It means the movement from the drug from the site of administration and into the secretion. Okay, and because the absorption, distribution, and the accretion is a movement of drugs, so we have defined them from some beginning to the ending. Okay, the beginning of the absorption is inside administration. Yeah, the site of administration, and the termination is secretion. So from the site of administration and into secretion, we call this movement is absorption. Absorption. You can see this is the figure shows where is the absorption from the administration to the secretion, and which administration route have no absorption. You can see here, because this is a gap between the administration with the secretion, so which administrative route have no absorption. You can think about it. That is IV. IV. Because intravenous, this is it's the site of administration is in the secretion. So the beginning is the ending, all is secretion. This administrative route have no absorption. Okay, and some factors will affecting the absorption. Some is drug-related factors, like some liquids is very good absorption than the solid. Yeah, and the lipid-soluble unionized drug have a better absorption than the lipid-insoluble and ionized drugs. Okay, this we have learned very well. And for some dosage form, you can see smaller have a good absorption, and others also will influence the absorption. Okay, next one is patient-related factors that affecting absorption. You can see one is about the route of administration. The very faster, most quicker, that is the inhalation. Because inhalation is directly into the respiratory system, the villi, and the villi have thin, very thin the burst and very close to the secretion. So inhalation is the first one. Yeah, the most rapid inhalation. Okay, next one, let's see some factors affecting oral absorption. Okay, drug-related factors. That is very similar than what I said. We should put our emphasis on the patient-related factors, like the pH and the GI transit time, influenced by the food and the first pass metabolism, and others. Okay, I will explain them one by one. First one, the pH of GI tract. Here, you should understand that pH influence only refers to what? Refers to simple diffusion, especially the lipid diffusion. Yeah, not others, only refers to the lipid diffusion. And I have said to you, when the drug is an acid drug, that will become more lipid soluble as the unionized form in the intestine. in the base environment. And well, when the drug is acid, weak acid drug, it will become more easier cross memory and become have a better absorption in the stomach. Yeah, let's just review that. We have learned very well. And although the acidic drugs are better absorbed from the stomach, but for the large portion of it will get up through the intestine, because the intestine have a great surface area. Here. Yeah, a good absorption not means a large absorption. So you should understand it. Next one about the gastric emptying rate and the gastric motor activity. Faster gastric emptying will accelerate the drug absorption. And this is for most of drug, especially the basic drugs. Okay, next one, presence of food. Most drug are absorbed better if taken in the empty stomach. That means the presence of food will slow down the absorption of drug. Yeah, you can hear food will decrease the absorption, like decrease the absorption of the ampicillin and aspirin and digoxin and levodopa. And in some exception, the food maybe also will increase other drugs absorption, maybe like the chloroquine and carbamazepine and lithium and reforms, like this one. But in most cases, the food will decrease the absorption of drugs in most of cases. So you can see, when a food decreases absorption, we should take the drug before the meals. But in some exception, we can take the food after meals. Okay, next one is a very, very important definition. What is first pass metabolism? First pass metabolism. Okay, it's natural is metabolism, but this is first pass. What means first pass? You can see here. It means the metabolism will occur before it reaches the systemic secretion. And the final result, that is, will decrease the bioavailability of the drug. Okay, say it again. First pass means the metabolism will occur before the drug reaches the systemic secretion, and then will decrease the bioavailability of drugs. It's still a metabolism, but the metabolism not occurs after the drug's action in the body. It is before. Okay, you understand it? Before it reaches the systemic secretion. So we call that first pass metabolism. Yeah, in some book it will have another name, like the first pass effect. Yeah, first pass effect. Okay, and because this is metabolism, and we know metabolism will be done by the enzyme. Yeah, the enzyme in the body. It means when the site exists enzyme, it will have the first pass metabolism, like the gut wall, like liver, like skin, like lung, or this place will exist the first pass metabolism. So when we talk about this definition, we just to put the emphasis on the time. The metabolism occurs before the drug and reaches the systemic secretion. That means the first pass metabolism. Now let's see a figure to understand it well. Okay, you can see this is oral administration. We give the drug by the oral administration, and then it will through all the GI tract, and some is unabsorbed and become to the feces, and some will be absorbed from a vein. What vein? The portal vein. Yeah, from the intestine and to the portal vein, and then reach to the liver. And in this whole process, it exists the enzyme. The enzyme will metabolize the drug. You can see, yeah, metabolize some and metabolize some, and here metabolized most of the drugs. And to here, through the whole process, finally the amount of drug into the secretion will decrease. This we called first pass metabolism. Okay, do you understand that? What's the mean about the first pass metabolism? Do you have any question? Okay, let's go. Okay, some students ask me, will the first pass metabolism drugs get into systemic secretion? Okay, here just for the oral, oral administration, and when it come into secretion, before coming to secretion, it can be metabolized by the enzyme, and the process is from the intestine to the intestine blood, and then into the portal vein, and from portal vein is into the liver. This is the whole process. And after metabolism of liver, the first pass metabolism, it finally will come into secretion. Okay, do you understand? Okay, next one, see some examples. The first pass metabolism, if this action is very, very strong, very, very high, it means finally the amount of drug will leave a small port. You know it. And if this first pass metabolism is weaker, it means most of drug can enter into the circulation. So we can understand the amount of drug according to the first pass metabolism. Okay, you can see this is very high, like the propranolol. For oral, we need to give maybe 100 mg to get a therapeutic effect. But for parental, for some injection, we just need only 5 mg to get the equivalent action. This is very high. It means it has very high first pass metabolism. It's not suitable for oral administration. Okay, and intermediate and low, I think this is is suitable for the oral administration because have a weak first pass metabolism. Okay, next one. You can see like some presence of other drugs. Different drugs also will influence drugs absorption, like the vitamin C. Vitamin C can reduce iron to the ferrous state, and then can increase the absorption of oral iron. Yeah, vitamin C can promote the iron to this form, so increase the absorption of the oral iron. Okay, this is about how a drug influence the absorption of other drugs, and like the tetracyclines cannot used combined with the ions because tetracyclines can bind these ions, and both of them will become more bigger and hard to cross membrane, and their absorption will decrease both of that. Yeah, include the tetracycline and include the iron and the magnesium. So we'd better use them in different time. Okay, next one. Some other factors affecting oral absorption include the disease condition. Yeah, disease condition. Like some malabsorption syndrome or decreased absorption. That's no need to say more. And anemia will increase the absorption of iron. Okay, this is the disease. Okay, next one. Let's see a pyramid. Can describe the absorption. The pyramid is bioavailability. It can sort for F because this is a fraction. This is fraction. Now let's see it's the pyramid, how to calculate the pyramid. Okay, see here. Bioavailability is a fraction of administrative dose of drug that reach systemic circulation in the unchanged form. Okay, it means you can see this equation. F is equal to A divided to D. A means the total dose in circulation. Here, circulation. And D means the administrative dose. So their division is a fraction. This is a fraction. Okay, once again, bioavailability is a fraction of administrative dose of drug that reaches systemic secretion. And according to this definition, we can do some calculation. I give you a question. Okay, we give 100 mg the drug A. Okay, maybe drug A. And finally, we measured in the circulation only 20 mg the drug A. So, what's the bioavailability of drug A? Okay, do some calculation. You better do some calculation. We give 100 mg drug A, and maybe according to some oral administration. And finally, we measured the drug A's concentration in the body, only measured 20 mg. What's the F? What's the fraction? What's the bioavailability? Okay, students, you can do some exercise. Okay, let's calculate it together. The F is equal to the A divided to D. Here, A is the dose in the circulation. So, this is 20 mg. Yeah, in the circulation. And D means the administrative dose. So, D is 100 mg and plus 100 percentage. And finally, that is 20 percentage. 20 percentage. Do you understand? Do you understand? How to get the 20 percentage? Understand? Just according to the equation. No. We just give 100 mg. This is administrated dose. And finally, in the circulation, we measured only leave 20 mg. So this is, let's see, the dose in circulation. So finally, this is 20 percentage. Okay, D means administrated dose. Okay, next one. Bioavailability refers to the rate and extent of absorption of drug from dose form as determined by the concentration time curve in the blood. we can see it have a good bioavailability. It means it have very rapid absorption and have a large absorption. So we use different parameters to describe the rate and the extent. Okay, this is for the different route to get different bioavailability. And for definition, IV have a 100% bioavailability. Yeah, because administrative dose is totally coming to the circulation, so the 100%. And this is bioavailability. Another definition is bioequivalence. Okay, next one. Let's understand what the parameter to describe the rate and extent of absorption. So what's the parameter to describe the bioavailability? We according to a curve. What curve? What curve? The plasma concentration and the time curve. Okay, you can see the y-axis is plasma concentration and the x-axis is time. And this means a drug will be given by the oral. So you can see, first, we can't measure any drug in the beginning because it's still in the GI tract. And from here, this point, we can measure the drug will come into circulation, and then will directly increase to the peak. And then our body will eliminate the drug A, so make the concentration decrease. So this is the oral administration, and this is the change of drug A in the body. Yeah, from the 0 to some to the peak, and then decrease, and finally over. Yeah. Okay, this is for oral. And here we have some parameters, like the effective region, from the minimal effective concentration to the maximum safe concentration. This is therapeutic region. And the peak is the Cmax, means the maximum concentration. Yeah, this point, and corresponding to the point in the y-axis, this Cmax. Okay, next is the time, this x-axis. Yeah, to the peak, it is responding to one time, and this time we call Tmax. This means the time at which maximum concentration is obtained. Yeah, Tmax. And this is latent period. You can see this point, because up to this point it will take action, and under it, it's still not reached to the effective dose. So the time before it, the time is latent period, and the time to another point that will means the time that a drug have no action below it. So this time is last period, and the next one is receipt period. Here we use Cmax and Tmax to describe the extent and the rate of bioavailability. You can see. And this is the curve, the whole curve. And this area is under the curve. We call this is AUC. AUC, yeah, from the 0 to maybe unlimited. Yeah, well, AUC can measure the extent of absorption. So when we compare the absorption of two drugs, we can use these three parameters to describe, to compare the rate and extent of the absorption. Use these three parameters. Now, let's see, bioavailability will equal to AUC after oral and divide to the AUC after IV. Because AUC after IV, we know the bioavailability is 100%. So you give this is equal to the total extent of drug in the body. And this represent what? Represent the administrated dose. This is the dose in the body. So you can see we can use this equation to, instead of the premise, the equation. Okay, next one. Let's combine this absorption of these three drugs. Drug A, drug C, and drug B. Okay, let's compare. Drug A. You can see I give you a point. So drug A is rapidly and completely absorbed. Because rapidly we can compare what? We can compare Tmax. Its Tmax here is between the C and the B. So I think it's rapid, but slower than C, slower than B, but quicker than C. And completely, we will see what? See the AUC. See the AUC of A. So the AUC of A is the biggest, have a completely absorbed. And drug B is have a rapid absorption, but incompletely absorption. You can see it's very quick, but the AUC is smaller than A and C. And C, you can see drug C is slowly and completely absorbed. Although the Tmax is large, that present is have a slow absorption, but the AUC of drug C is very big, so have a complete absorption. Okay, this is about the figure to show that, what implies that. Now let's see some exercise to understand the absorption. Every student, you need to see the questions. The first question: which of the following describes the first pass elimination? The elimination means the metabolism. So you can understand well about the question is what's the best description to the first pass metabolism? Which one? Okay, no doubt we should choose some keyword to get the right answer. Now you can see A. The drug given orally is metabolized by the liver before entering enteral circulation. So A is the correct. The keyword, one keyword is metabolized. The second keyword is before. Before. Yeah, before entering the circulation. If this is metabolized after entering the circulation, we not call the first pass. We just call them metabolism, not the first pass metabolism. So this is difference. This is difference. Okay, second one. Bioavailability of drug is maximal when the drug is. Okay, choose one. Okay, no doubt. Here, bioavailability of drug. If this is will become very good, we need the drug is lipid soluble because most of drug cross membrane, yeah, get a good absorption is through the lipid diffusion. So the high lipid soluble drug have a good absorption. Most of drug can cross membrane from the intestine to the circulation and finally to the systemic circulation. So have a good absorption. And for A, very large molecular weight, so no. And highly bound to plasma proteins, we have not talked it. And highly ionized is become very hard to cross membrane, so not C.